This presentation will cover the essential anatomy of the scapular muscles. You will learn about the critical role these muscles play in the overall function of the upper limb, as they are the major suspensory apparatus and stabilizers of the limb. Next, you will explore the individual movements of the scapula that result from scapular muscle contraction. This will set the stage for the individual study of each of the 7 scapular muscles. In conclusion, you will review the common features and functions shared by this important muscle group. Let's look at the scapular muscle role in suspension of the limb. We will begin by establishing an inherent problem in the anatomy of the upper limb. In stark contrast with the lower limb, note that the upper limb has no ligamentous attachment to the vertebral column. Compare this to the strong ligamentous connection formed between the ilium and sacrum at the sacroiliac joint. The only ligamentous connection between the upper limb and axial skeleton is the weak connection formed between the clavicle and sternum at the sternoclavicular joint. As you can see in this cross-sectional illustration, made below the level of the clavicle, the scapula, which is the skeletal base of the remainder of the limb, has no ligamentous connection to the axial skeleton. As a result of this weak association with the axial skeleton, the limb would easily droop inferiorly under the load of its own weight. Because of this structural instability, any activity produced by any of the muscles in the limb proper would not have a stable base upon which to produce the desired muscle actions. What is the solution to this inherent dilemma? The solution is a fairly simple one. Annex or borrow a group of body wall and head muscles, which already form strong attachments to the axial skeleton, and connect them to the scapula to create a muscular sling to suspend and anchor the bones of the pectoral girdle to the vertebral column and ribs. Problem solved. Next, let's look at the scapular actions. Now that you understand the important functional role of the scapular muscles in anchoring the pectoral girdle to the axial skeleton, it is important to understand the scapular movements that result when these muscles contract. Because the scapular muscles attach to either the stable vertebral column or ribs at their proximal end, and to the much more mobile scapula and or clavicle at their distal end, contraction of the muscle produces movements of the scapula and clavicle. These movements are typically described as scapular movements, but because the scapula and clavicle are connected, when one of these bones moves, so does the other. Because the scapula is a generally flat plate-like bone situated against the rib cage, the movements that occur when the muscles pull on it are a series of sliding or rotational movements. Let's explore the movements of the scapula. Adduction, also called retraction, is the movement of the scapulae toward the midline or vertebral column, as in standing at attention by pulling your shoulders back. Abduction, also called protraction, is the opposite movement of the scapulae, away from the vertebral column. Because of the curvature of the rib cage, note that during abduction, the scapulae follow the curvature of the ribs and move both laterally and anteriorly around the rib cage. Elevation is the upward movement of the scapulae, as in hunching your shoulders by raising both scapulae upward. Depression is the opposite of elevation. When you relax the muscles that elevate the scapulae, then the scapulae fall back to their normal position via depression. Upward rotation tilts the lateral aspect of the scapulae, the glenoid cavity, or shoulder socket, and acromion upward. Note, however, that the entire bone does not move superiorly as during elevation. This movement of upward rotation reorients the shoulder joint and moves the rest of the limb away from the body in the process. Downward rotation resets the upward rotated scapulae back to the normal position. This movement, like depression, can result as the upward rotators relax and gravity creates the downward rotation. Before I introduce you to the 7 scapular muscles, I would encourage you to review the strategies for learning muscles that I shared with you in the movie titled Anatomy Learning Skills, Muscles. Recall the following key strategies. 1. Make the muscle name work for you. 2. Visualize the muscle and touch it on your own body. 3. As you visualize the muscle, describe where it attaches to bones. If you've not yet had the chance to learn the bones of the body, watch the movie The Skeletal Primer for the scapular muscles. 4. Note which joints it crosses and deduce the actions it produces. 5. Group muscles and understand their shared similarities. Now, let's begin learning the scapular muscles. The first scapular muscle we will explore is named the rhomboid major, or rhomboideus major. Let's begin by analyzing the name and visually studying the muscle. That is, let the name and image of the muscle become your teacher. Too often, students think they need to be instructed before they can learn. I want you to trust yourself. Almost every word we write about anatomy is because someone observed and recorded what they saw. You can do it also. What does the name tell us? The muscle is a rhomboid. That is, a four-sided shape with parallel sides. Furthermore, it is a big rhomboid, and it informs us that there is a little one. Anatomists never use comparative terms like major and minor, lateralis and medialis, longus and brevis, unless there are two similar muscles that they are using a similar name to describe. Next, let's zoom in on the muscle so we can view it in more detail. Note where it sits in the body and the orientation of the muscle fibers. This will help you describe the muscle attachments and actions. Let's look at the muscle's attachments to the skeleton. If you feel you do not have a strong enough knowledge of the bones of the skeleton, then watch the movie titled The Skeletal Primer for the Scapular Muscles. Once you know the bones, learning the muscle attachments is easier because you simply describe what you see. Let's try it. Note the skeletal landmarks marked with red. What are these bony landmarks? Think about it and try to describe it. Be as precise as possible. Let's check and see how you did. These red landmarks form what we call the proximal attachment, or origin of the muscle. Now try to determine the insertion of the muscle. How did you do? Now that you have visualized the attachments and you see how the fibers are oriented between these bony landmarks, imagine the fibers shortening and pulling the mobile scapula toward the vertebral column. Describe the actions that you visualize as a result of the muscle contraction. Let's check and see how you did. Adduction, or retraction of the scapula, is fairly obvious. But did you recognize the muscle can also downward rotate? Note that when the scapula is rotated upward, that the inferior angle moves away from the vertebral column and stretches the lower fibers of the rhomboid major. Now, when the muscle contracts, it rotates the scapula downward. To complete our understanding of the muscle, it is important to realize the relationships the muscle forms with other muscles, or the muscle topography. As you observe the skin-covered back, try to visualize the muscle through the skin. Let's look through the skin and see if we can observe the rhomboid major. Note that it is partially visible, but that the majority of the muscle is covered by another large muscle, the trapezius, which we will encounter later in this series of muscles. If I make the trapezius transparent, then notice that you can see the rhomboid major. So we see that this is a deeper muscle. Now let's see it on a real body. Again, note that when we make the skin transparent, we only see a small part of the muscle extending from below the trapezius muscle. When the trapezius becomes transparent, the rhomboid major becomes visible. And if the trapezius is made completely transparent, we see it quite nicely. Let's move to the next scapular muscle. Now that you have seen the strategy of how to learn a muscle, we can work through the remaining muscles more quickly. Always remember, visualize, observe, and describe. Trust yourself, and you will better learn and remember the muscle anatomy. The next muscle in the series is the rhomboid minor, or rhomboideus minor. Let's make the name work for us. Once again, we observe a rhomboid-shaped muscle, but this time it is smaller than its larger predecessor. As we zoom in on the muscle, we note that it is a smaller version of the rhomboid major and sits superior to the level of the major. Note its fiber orientation and its association with the skeleton. Now, can you describe the attachments of the rhomboid minor? Try it and be as precise as possible. Let's check the attachments and see how you did. Knowing the attachments, visualize the muscle shortening and describe what action the muscle would produce. Give it a try. Note that because of its attachment at the mid-region of the medial margin of the scapula, the muscle is primarily an adductor or retractor of the scapula. Let's finish our study of the rhomboid minor by observing its relation to other muscles. Note that with the skin transparent, the rhomboid minor is still not visible, as it is completely covered by the trapezius muscle. If I make the trapezius transparent, the rhomboid minor is now visible. On the image of the real body, we again see that to see the rhomboid minor, we have to make the skin and trapezius muscle transparent. Let's move to the next scapular muscle. The next muscle in the series is the levator scapulae. The name levator scapulae describes the movement the muscle makes when it contracts. That is, it elevates the scapula. This is the kind of name that you should really like, because it kills two birds with one stone. That is, when you learn the name of the muscle, you also learn the action that it produces. Let's flip the body around and take a look at the levator scapulae from the anterior view. Note that in this view of the individual muscle, it is not as clearly visible. As we zoom in on the muscle, we again note it is not as visible from this anterior view. So let's turn the body around and view it once again from the posterior view. Note its fiber orientation and its association with the skeleton. Now, can you describe the attachments of the levator scapulae? Try it and be as precise as possible again. Let's check the attachments and see how you did. Knowing the attachments, visualize the muscle shortening and describe what action the muscle will produce. Remember, this should not be difficult because the name already informed you of what the muscle does when it contracts. Let's finish our study of the levator scapulae by observing its relation to other muscles. Note that with the skin transparent, the levator scapulae is visible at the superior lateral aspect of the trapezius muscle. If I make the trapezius transparent, the levator scapulae becomes even more evident. Observed from an anterior view, note that the muscle is visible when the skin becomes transparent, as it sits anterior to the trapezius muscle. However, to fully see the muscle, numerous muscles in the anterior neck and the mandible or jawbone have to be made transparent. On the image of the real body, we again see that to best visualize the levator scapulae, I have to make the skin and trapezius muscle transparent. Let's move to the next scapular muscle. The next muscle in the series is the large trapezius. The trapezius muscle is a large superficial muscle of the upper back and neck. To make its name work for us, we need to turn the muscle around to the anterior view. Now, if we cut the muscle away from its attachment to the clavicle and fold the front part back so that it is in the same plane as the rest of the muscle, we clearly see that it is a trapezium. That is, a four-sided shape with none of its sides parallel. As we zoom in on the muscle, you will note that it is not as visible from the anterior view. So let's turn the body around and view it once again from the posterior aspect. Note the relationship of the trapezius to the skeleton and pay specific attention to the fact that the muscle fibers radiate in multiple directions from the scapula and clavicle toward the vertebral column. Now, can you describe the attachment of the trapezius? Try it and be as precise as possible. Let's check the attachments and see how you did. The term nuchal ligament that you see as part of the muscle origin is a strong ligamentous structure that spans from the external occipital protuberance to the spinous process of the sixth cervical vertebra. The trapezius, along with other muscles, attach to this strong ligamentous band in the neck. Observing that the trapezius has an extensive origin from the skull to the bottom of the last thoracic vertebra, and has fibers that converge from different directions toward the scapula and clavicle from this broad origin, can you determine the actions of the trapezius when it contracts? Give it a try. Let's see how you did. Note that the middle fibers of the muscle course from the acromion and spine of the scapula horizontally toward the vertebral column. Contraction of these fibers adducts or retracts the scapulae. Note that the upper and lower fibers of the trapezius both rotate the scapula upward. The superior fibers attach to the clavicle laterally and raise the lateral end of the clavicle, which then rotates the scapula upward. Observe that the lower fibers attach to the medial border of the scapula at the base of the spine. When they contract, they rotate the medial side of the scapula downward, which then upward rotates the scapula. Topographically, the trapezius is a superficial muscle, as we have seen that we had to make it transparent to see the previous muscles we studied. Note that when we make the skin transparent, we can easily observe the trapezius muscle. Let's jump back up to the table of contents and explore another scapular muscle. The next muscle in the series is another large muscle, the serratus anterior. From a posterior view, the serratus anterior has limited visibility. If we rotate it anteriorly, we get a better view of the muscle. Let's rotate it to the lateral perspective to clearly see how it was named. Serratus means saw-like. As you can clearly see, its saw-like anterior edge. Let's zoom in and study the muscle in more detail. Notice from the lateral view that it disappears under the scapula. This is even more evident from the posterior view. It is the anterior view that gives us the most complete view of the muscle. From this anterior view, can you describe the muscle's attachments to the skeleton? Give it a try. Let's check the attachments and see how you did. With a clear knowledge of the attachment, see if you can deduce the actions the serratus anterior produces when it contracts. Let's see if you made the proper deduction. abduction or protraction is fairly obvious. Note that the muscle pulls from its anterior attachments on the ribs and moves the scapula laterally and anteriorly around the rib cage. Note also that the fibers from the lower ribs pull the inferior end of the scapula laterally, which rotates the scapula upward. From the posterior aspect, the serratus anterior is a deep muscle. Looking through the skin, you can see that it is not visible. If I make the teres muscles and the latissimus dorsi transparent, you can see a small part of it. To see more of it, I have to make the scapula and muscles attaching to both of the scapular surfaces transparent. From the anterior side, it is easily visible through the skin on the lateral surface of the ribs. But to see more of the muscle, especially at its superior part, I have to make the pectoral muscles of the chest transparent. Watch as I reveal the topography of the serratus anterior on the image of a real body. The final muscles in this series are both on the anterior side of the body. Let's study the pectoralis minor muscle first. Again, let's make the name work for us. Pectoral means the breast region, and this is the little muscle of the breast. If we flip to a lateral view, you can note how the muscle angles backward onto the scapula. Let's zoom in on the muscle to get a better view and rotate it back to the anterior view to better analyze its attachments to the skeleton. Can you describe the attachments of the pectoralis minor? Try it and be as precise as possible. Let's check the attachments and see how you did. Knowing the attachments, visualize the muscle shortening and describe what actions the muscle will produce. Give it a try. Let's see if you determined the correct actions for the pectoralis minor. From the lateral view, you can easily see how the muscle pulls the scapula laterally and anteriorly around the rib cage. With the scapula rotated upward, notice how the muscle is stretched. When it contracts, it rotates the scapula downward. Let's finish up by observing the topography of the muscle. Note that it is not visible when you look through the skin. I have to make the larger pectoral muscle transparent to see the pectoralis minor. Now, let's observe the topography on a real body. Let's go back to the contents and look at the final scapular muscle. The last muscle in the series is the small subclavius muscle. The subclavius muscle is the smallest of the scapular muscles. Technically, it is not a scapular muscle because it attaches to the clavicle, and not the scapula. Functionally, however, it moves the scapula by moving the clavicle. What does the name reveal? Think of a submarine, a boat that is below or under the water. The subclavius is below or under the clavicle. Let's zoom in and analyze the muscle in more detail. Can you describe the attachments of the muscle? Give it a try. How did you do? Based on the attachments, can you deduce the action the muscle produces when it contracts? Notice it pulls down on the upward tilted clavicle. It pulls the clavicle downward, which in turn rotates the scapula downward. Let's finish our study of the scapular muscles by viewing the topography of the subclavius muscle. To see this small, deep muscle, I have to make the skin transparent, and then the pectoralis major transparent, in order to see the subclavius. Let's check it out on a real body also. Now, let's review and summarize the scapular muscles. A quick review of the scapular muscles will allow you to see the big picture of this muscle group. Note that on the posterior side of the body, all the muscles originate from the skeletal midline, from the base of the skull to the bottom of the thoracic region. Whereas on the anterior side, the origins of the muscles are from the rib cage. From these points of origin, the muscles project onto the scapula and clavicle to anchor the scapula in a muscular sling. As a result, this important muscle group anchors the scapula and thus the entire upper limb to the rest of the body. These muscles also produce the 6 movements of the scapula. In addition to anchoring the limb to the body, the muscles stabilize the scapula, so other muscles can function more efficiently. This is made possible as opposing muscles work together to hold the scapula steady. For example, if the adductor muscles contract at the same time as the abductor muscles, then their movements are canceled by one another and the scapula is held perfectly stable. This then completes our study of the scapular muscle group.